pre-existing conditions might be best handled. The questions that I have are, what measures are being considered to address current insurance industry practices for pre-existing medical conditions, a standard that impacts millions of Americans' their ability to obtain necessary medical care they need? And someone asks, will the proposed health reforms offer better ways to help individuals manage chronic conditions? Now, you mentioned that the market is moving to address it, but I think it would be fair to say slowly. So would the market provide coverage for pre-existing conditions on its own?
The marketplace should. United Healthcare is doing that today, just as one example. Other insurance companies are also providing an incentive for wellness. And I think it's important to understand, as much as we need to understand about chronic illness, we need to understand enough about wellness. Both of these are opportunities in the marketplace for someone really to focus on an illness that they have that would really require an intensive amount of, not just insurance, but an intensive amount of medical care. If we have a better marketplace, more insurance, bigger pools that can be accomplished by allowing individuals to have the same pre-tax opportunities that corporations get, then we can give to individuals, by getting them in the marketplace, a larger pool, and then let that healthcare provider work with them on wellness as well as chronic illness. But the bottom line is that insurance today should and must move to where we eliminate the pre-existing conditions, and then we focus on the problem of wellness and chronic illness.
Congresswoman Johnson.
Well, I can't disagree that we will focus on wellness and prevention. Right now, most insurance coverage plans will not cover primary care. And that is a way to cut the cost for healthcare delivery, because if someone knows how to take care of themselves and not end up in the emergency room for just a sick visit, then the cost would be cut. But because insurance companies do not cover primary care, which is preventive care, it does create a problem. Many people that have a large copay or don't have coverage at all will wait until they're sick, then end up in the emergency room. The highest cost of any health care is emergency room care. And it has been a lot of that in this area where there's no other outlet for people that get sick. And there is a difference in having primary care and not having primary care. An example is that we have a number of community health centers. When people get in the habit of going and getting instructions as to how to take care of themselves, let me just use diabetes as an example. They learn how to take care of their own diabetes, whether they need medication, and they know how to check their own urine and what have you, versus someone who does not get any of that and start to have difficulty with their diabetes, ended up in the emergency room with no prior record that the physicians can look at and see what the problems have been in the past. They get more tests. Many times there is even a communications problem, not understanding words and what have you. It's a lot more costly for someone to allow their diabetes to get out of hand and end up in the emergency room with all types of IVs, all kinds of tests, because they have no history there. That's the one thing that is a key priority for the current president, and that is to use technology, because it will cost much less when a person ends up in the emergency room or anywhere else, and they can pull up and see what the history has been. Because we don't have that now, and because we don't have primary care covered by insurances, we pay a lot more for sick care.
Thank you, Congresswoman Johnson. We have a number of questions on preventive issues, but since you've touched on them, I'm going to move past those and go to the question of a public option. And